A soft tissue injury is damage when trauma or overuse occurs to muscles, tendons, or ligaments throughout the body. With different causes and symptoms, soft tissue injuries fall into two basic categories: acute injuries and overuse injuries. Typical acute injuries include sprains, strains, and contusions. Tendinitis and bursitis are common soft tissue overuse injuries. Soft tissue injuries can result in pain, swelling, bruising, inflammation, stiffness, and loss of function. Even with appropriate treatment, soft tissue injuries still require a prolonged amount of time to heal. Therefore, it's important to find out a safe, natural, easy, and highly efficient method to help with soft tissue injuries. PEMF therapy is just what you need. By increasing the motion of ions and electrolytes in the tissues, PEMF therapy can raise ATP levels and help cells increase their energy by up to 500%. In other words, PEMF therapy can stimulate self-healing of damaged soft tissues and relieve injury-related pain while sending pulse energy into the problem areas. Soft tissue injuries are usually accompanied by severe inflammation. The enzymes that stem from inflammation can damage the tissues further. PEMF therapy can reduce the inflammation of the tendons and ligaments and maintains a healthier level of synovial fluid, so your joints can move freely without any restriction. Additionally, PEMF therapy can improve the function of damaged soft tissues by promoting blood circulation. The damaged soft tissues require enough oxygen to recover themselves. PEMF therapy can stimulate the blood vessels to carry plenty of oxygen to the cells and tissues, leading to a proper function circulatory system to reduce swelling and pain derived from soft tissue injuries.